Okay, good afternoon, everybody. Thank you very much for tuning in to our sixth webinar organized by the Institute for Minority Rights at Eurac Research in Bozen, Northern Italy. Today's topic is focuses on gender and pandemic, a very topical issue. And my name is Georg Grote. I'm a historian, senior researcher in the Institute for Minority Rights, and I'd like to introduce to you our panel today. We have a very interesting panel, and judging by the discussion we've already had before we came on air, it's going to be a very interesting hour, I'd say. We have four panelists. First of all, Lindsey Earner-Byrne, Associate Professor in the School of History in University College in Dublin. Secondly, Anuj Kapilashrami, I hope I pronounced that properly. Currently Senior Lecturer in Gender and Global Health Policy in Queen Mary University in London, but in 2 weeks' time moving over to the University of Essex, and then being a Professor of Global Health Policy and Equity Studies in the School of Health and Social Care. We also have Sebnem Kenis, Senior Policy Advisor on Gender and Human Rights at the Raoul Wallenberg Institute of Human Rights and Humanitarian Law. And finally, Zsuzsa Blasko, a Research Fellow in the European Commission, who is talking to us from Budapest today. Thank you very much for joining. Quick focus on the format of today's webinar. It's supposed to last for about an hour, maybe a few minutes longer, because we have four panelists today, and I would like to make sure that everybody gets their points across. We're going to start with a short introductory session whereby the four panelists are going to talk about their research areas and the topics that interest them most in the context of gender and the pandemic. About 5 minutes each, and then we're going to engage into a discussion where the four panelists, myself, and everybody who's interested can participate. My colleague Kerstin Ronisch is collecting the questions, which are then being passed on to me via Skype, and I try to weave them into the conversation. That format has worked quite well, and I hope it's going to work well today as well. So thank you very much again for being there. Can I ask Zsuzsa Blasko, first of all, to start with a short introduction of what she does and what her interest in that particular topic is?
Thank you, Georg. As Georg introduced me, I am working for the European Commission, in particular at the Joint Research Center in Italy, where we very soon after the pandemic started reflecting, of course, on social consequences that we could foresee at the time, and gender inequalities was one of the key areas where we wanted to make sure that we keep monitoring, and we try to make some predictions timely and present some first evidence to the European Commission and to policymakers in Brussels. So with this aim in mind, we produced what we call a JRC technical report. It was titled, "How will the COVID-19 affect existing gender divides in Europe?" We wrote this report quite early in April, so obviously it doesn't include any new evidence that already this would tell us about what is happening during the pandemic. Instead, we relied on pre-COVID evidence and our understanding on gender inequalities, and we were trying to foresee what might come, and we were trying to draw the policymakers' attention to the main threats and the main challenges the pandemic might impose on gender inequalities in Europe. So we also have a European perspective, where we considered actually three main topics to be of crucial importance. One is the division of paid and unpaid work across gender. One is women's underrepresentation in leadership and decision making. And finally, we also had a small section on domestic violence, which was obviously a major threat and still is during the lockdown. In my short talk today, I will try to focus on paid and unpaid work, give you some insight on what we described in April, and also I will try to signal where we already see that there are some new research evidence coming up, more or less supporting our expectations. But I have to say that whatever research evidence we have today is still very preliminary and doesn't give us, well, it doesn't, of course, not give us a view of the full picture, and doesn't give a good enough insight into the complexity of the issue we are talking about. So we kind of see some major tendencies, but not the details. And I think it's crucial that later on we understand those better. So basically, in terms of what is happening in the field of work, first question is obviously, or kind of automatically, is how the direct economic impact of the crisis affects men and women. And from the beginning, it could be seen that this crisis is different from the kind of classic historical ones, when mostly men's job, or at least men's jobs, were more threatened. There were more men losing their jobs, but as it was usually in the manufacturing being worst affected. This is, however, not the case today. We know very well that the service sector is badly affected, and what we already can see from some statistics, that women are at least as badly hit by unemployment as men are. So there is already a major threat on women's employment position from the direct effects. But I think what is equally or even more important, and this is much more contradictory and more interesting to see in many ways, that this what we are experiencing today is has an unprecedented effect on our domestic life and on the way we have to cope with our household duties. The amount of unpaid work in actually all the three areas, which would be childcare, care for the elderly, and household duties, in all these areas there is a massive increase in the amount of work that households have to cope with, and that partners have to divide between them. And this is a challenge that we have never seen before, and is still to be seen what it will bring about in terms of gender inequalities. So it could be foreseen easily from the beginning, but now we actually have evidence from some time use survey and other type of surveys indicating very clearly that there is a massive increase in the overall burden, especially in households with young children, where parents have to cope with employment, very often with 2 jobs, and at the same time looking after their children. Again, we could easily predict in April already, based on our preliminary knowledge about the still very traditional gender norms in Europe and about the existing division of unpaid work, that no matter how much this workload will increase, women will continue taking up the majority of this. Again, we expect huge heterogeneity across countries. Even if we just look at gender norms from pre-COVID times, we know that it's, Scandinavian countries are far ahead of many South and Eastern European countries in terms of to what extent they believe that it's women's job to take care of families and children. Still, the major tendencies across the countries that the increased workload is taken up more by women than by men. The question arises how mothers can cope with the situation. So how they can adjust the paid work and this invisible or previously invisible work these days. Here we have very little evidence what can be expected as a very radical response. Some are actually quitting their jobs to be able to take care of the families. In the US, they already report evidence on this. My expectation is that this is happening to a somewhat lesser extent in Europe for various institutional reasons, but still it can be the case that under strong pressure, there is no other way out than actually leaving the labor market and just staying at home with the kids for a temporary period of time, but we have to see how long it has to continue. Other less extreme, but still quite challenging responses can be reducing a number of working hours or taking up paid and unpaid leaves, or without changing the formal work arrangements. What we also witness these days is that women have lower productivity in their working than men do. There are, again, evidence coming out mostly focusing on academia, where it can be observed that the number of submitted papers in some areas has been much lower among women than among men during the pandemic. signaling quite clearly in a measurable manner that mothers have more additional work to cope with. All these possibilities will have long-term consequences, of course, depending how long the situation continues, but most likely, in many cases, there is a strong risk that what is happening today and the disruptions women have to take up in their career in these days will have a longer-term effect on their employment prospects, not mentioning the short-term well-being problems they have to face.
Can I at that stage, can I thank you at this stage for the introductory remarks? Okay. We're going to come back to your points because you raised some very, very important ones. But I'd like to pass on to Anuj Kaplashrami and ask her about her sort of introductory observations on that issue. Yes.
Right. Thanks, Georg. Yeah. Can you hear me now?
Yes, perfect.
Okay, great. No, thank you for this, creating this platform and for allowing us to debate on this important issue. And I think as a starting point, I just want to emphasize on how COVID-19 has not itself created these new inequalities, but I think what it has done very effectively is shed light onto the existing, prevailing, entrenched deep inequalities that existed in our society. And I think looking at gender inequality is really critical. And I feel while evidence is yet to catch up with the fast changing and widespread impact of the pandemic at multiple levels, including the social, political, economic dimensions, but also health impacts, we already know that a range of effects can be anticipated that will be distinctly gendered. And these include, and we'll be touching on a number of these in this webinar, but they can include the burden of domestic tasks, care of vulnerable elders, food sharing under scarcity, and access to technologies, how digital divide impacts on women and men differently, and also exposure to risks with the nature of employment that the different sort of genders are involved in. And finally, what has really been talked a lot about more recently is the effect on domestic violence, but I also want to include other forms of violence that prevail in the non-domestic front, in the informal sector and informal economy, for example. So we know, for instance, that the responses to COVID-19 with the imposition of lockdown has really aggravated the already enormous magnitude of gender-based violence. In fact, it has also earned the title of a shadow pandemic in many countries. However, in many countries, even the government advisories and orders with regard to essential health services continue to ignore the increasing prevalence of and incidence of gender-based violence as a public health issue and provide those services as essential part of essential services. What we are frequently seeing now are examples of, I mean, there are arguments being made that the violence incidence has really reduced, but of course that is an implication of the absence of reporting. And we also need to look at different contexts in which domestic violence gets perpetrated. Often in countries in South Asia, where my research is, we also see that survivors are living in joint families and in their marital homes without access to personal telephones. And therefore, that really constrains their access to any form of justice-seeking initiatives or institutions such as health services and so on. Now, we know that there are these multiple burdens, but my main argument that I want to make today is that these burdens are not shared equally. All women or men or trans people are not similarly affected. And that's going to be my core thesis today and take home point. We have for very long been thinking about the binaries, and what I've witnessed in the last 3 months has been a fairly polarizing debate on gender, that men are dying more and therefore we need to emphasize more, on what are these factors that put them at risk versus women have more care burden and care roles. And I feel this kind of a narrow focus reinforces sex-based, binary and competing understandings of the burden posed by COVID-19 on women versus men, as well as reducing analysis to a simplistic messaging that pandemics either that men are dying more and women are more burdened, or pandemics affect women and men differently. So what I'm trying to argue here is that when examining these gender implications, for example, with regards to care burden or household work, we really need a differentiated assessment incorporating class, ethnicity, religion, and other dimensions that have an important role to play in this. The burdens are likely to increase for women, clearly in terms of the triple burden that they were already, triple roles and triple burden that they already played in productive economy and reproductive roles, as well as community and caring roles. But class and ethnicity will be important stratifiers of these experiences, as we're already seeing in different countries. We see in poor households, women and girls are likely to bear the brunt of additional workloads. But among professional couples who have to now manage without their part-time domestic help, it could also mean people are sharing work more equally. There are changes in the gender power relations and dynamics within households. While among rich households with live-in help, this may barely cause a ripple. At the same time, as what we will see as lockdown eases, or in cases even with the imposed lockdown, domestic workers who continue to serve households are also increasingly subjected to harassment for spreading infections. So, and domestic work, for example, is concentrated by women. So I think we really need a fairly disaggregated understanding of this phenomenon and look at how the multiple axes of vulnerabilities impact each other. I'll give just one or two more examples. One, for instance, even if we look at the health system, we know frontline health workers are at increased risk of dying with COVID. But if we look at the global figures, the majority of frontline health and social care providers are women, 70% globally and almost 90% in many low middle income countries. They're really comprising the backbone of health systems in these, and especially the primary healthcare system, and performing critical roles which are really patient facing, the ANMs, the ASHA care workers, the carers, and so on. And that requires maximum contact with populations, but they continue to be voluntary or on poor pay and least likely to be able to access PPE and social protection in society. So we're seeing in the current scenario, supplies of safety equipment as lagging far behind the need and demand, but the female frontline cadre in low resourced and deprived contexts have a disproportionately high risk of both catching as well as spreading infection. And nearly half of the USD 3 trillion that women contribute annually to global health is in the form of unpaid.
Okay, unfortunately, there seems to be a problem on the line. Can I use that opportunity to pass on to Sebnem Kenis and ask her about your approach to today's?
Sure, thank you.
Thank you.
Since the beginning of the pandemic, we have heard countless times that we are all in this together, but this is not accurate. Even if we are all in this, we are not in the same ways. As previous contributors discussed, COVID crisis affects people differently due to already existing structural inequalities and power asymmetries and cultural and social norms within our societies. And gender is one of the key dynamics shaping how people are influenced by the ongoing pandemic. Gender inequalities in interplay with race, ethnicity, class, ability, or migration status shape the COVID's impact on people's lives and their access to human rights. Previous speakers already discussed COVID's impact on women's unpaid caring work, women's employment, and domestic violence. And I believe Lindsey will discuss sexual and reproductive rights in the context of COVID. So I would like to contribute to the discussion by talking about COVID's impact on girls' right to education and human rights of LGBTI individuals in the context of COVID. COVID crisis and temporary school closures have also severe negative gendered impacts on human rights of girls, including right to education and other rights, other interrelated rights. In many countries, schools are closed and have moved to remote learning. There are some important gendered aspects to consider here. First, girls' return to school are in jeopardy in many contexts, especially in poor, rural, marginalized communities. Past experiences indicate that temporary school closures during times of conflict, war, or emergency situations might mean a permanent end to education, particularly for girls. While boys are generally sent back to school once the schools reopen, this is not the case for girls. Girls are 2.5 times more likely to drop out of school than boys. In 2015 alone, around 39 million girls were out of school because of war and disasters. This causes lifelong consequences, including fewer employment opportunities, increased chance of spending their life in poverty, early marriages, or early pregnancies. States, the governments should take necessary measures to make sure girls can equally attend online and remote teaching, and also they will return to schools once the schools are reopened. School closures also increase the risk of sexual exploitation, abuse, and even female genital mutilation. In Somalia, for example, huge rise in female genital mutilation has been recorded during coronavirus lockdown. According to the reports, the families in Somalia were taking advantage of school closures to carry out FGM so that the girls had time to recover from the ritual, which can take weeks. Kids are stuck at home with parents and can't actually reach for help that they may normally get from teachers in the school. So these are important aspects that the governments need to consider when they are designing their COVID response. I also would like to say a few words about COVID's impact on LGBTI communities. Cases of stigmatization, discrimination, hate speech, attacks on the LGBTI community are being reported in several countries. A number of Latin American countries, Panama, Peru, Colombia, introduced gender-based lockdown schedules. In Panama, for instance, women are allowed to leave the house to buy essential goods on Monday, Wednesday, Friday, while men are allowed on Tuesday, Thursday, Saturday. This caused huge problems and huge right violations for transgender and gender non-conforming individuals. They are being stopped, questioned, harassed, body searched, fined, or arrested by law enforcement as their assigned gender, as marked on their national ID cards, do not conform to the quarantine schedule. These gender-based lockdown schedules should urgently be lifted as they go against equality and non-discrimination principles. Also, there is an increase in homophobic, transphobic rhetoric of blaming LGBTI community for the COVID pandemic itself. These are reported, for example, in Iraq, Israel, Turkey. It is especially worrisome that this rhetoric is voiced by well-known clerics, legislators, and officials whose power and publicity may incite hate crimes and attacks against LGBTI community. Another problem is domestic violence against LGBTI youth, especially against those who are forced to isolate in hostile environments, hostile homophobic or transphobic family environments. Closures of campuses, colleges, dorms left many LGBTI students with no choice but going back to family homes, where some of them have to deal with homophobic violence. And situations are worse in countries where sexual orientation and gender identity are directly or indirectly criminalized. This limits their ability to access justice and support for fear of persecution. There are also reports of police or local officials using COVID directives to attack and humiliate LGBTI individuals and organizations. In many countries, police, soldiers, or neighborhood watchmen have been more present on the streets to ensure implementation of lockdown measures. And abuse of state power combined with homophobia and transphobia result in horrible accidents. In a village in the Philippines, for example, village officials detained 3 LGBTIs for being outside after the curfew. And officials then publicly humiliated them by ordering them to kiss, dance, or do push-ups, and they broadcasted this on live on social media. This lasted like a few hours. These are all very dangerous incidents. They demonstrate the need for oversight and accountability of law enforcement. Abuse of state power by law enforcement should be prevented. Let me stop here, and then in the second round, I can continue contributing more. Thank you.
So much. Thank you so much for your contributions today. Lindsey Earner-Byrne.
Hi, I will introduce myself as slightly a fish out of water as a historian, but one of the reasons why I was really interested in partaking in this seminar is because one of the big things we're interested in as historians is whether a moment is transformative or not. And moments of crises can be either transformative or they can batten down existing hatches. And one thing that's really interesting, and I don't think is a coincidence, is the degree to which worldwide we're witnessing protests which center around the issue of racial justice particularly, and what lives matter and in what way we prioritize and protect more vulnerable sections of our society. So from my point of view as a historian, I'm really interested in looking at what groups are managing to find space in the way in which we discuss the impact of COVID. Historically, we would see that when a crisis occurs and things are planned in haste, it's usually the powers, the voices that are ascendant that really benefit from the way in which we deal with these things. And so looking at what voices are absent, it's quite clear that gender, particularly female, and also those in lower socioeconomic brackets, and also ethnic and racial minorities are all groups which are going to find it more difficult to get some traction within the debate about COVID and its impact. As to whether it's going to be transformative, time will tell, but there are certain warning signs, I think, within the discussions of the role of women within this environment. So for example, one thing that's come very clearly is the degree to which domestic violence has come under the spotlight, both in terms of fear for women who were in lockdown situations and unable to escape possibly abusive or violent situations, but also the degree to which, the positive side of that is the degree to which the actual fact of domestic violence is being discussed certainly in many countries in a much more open way, simply because of all the supports that are closed or inaccessible to women or people in those violent situations. And the other thing, though, that is much more difficult to track is the degree to which access to birth control or to reproductive rights is being compromised by the current COVID situation. One of the aspects of history within Ireland and more broadly in Europe I'm interested in is the history of reproductive rights and bodily integrity within that context. I've just completed a book looking at abortion rights on the island of Ireland. And of course, these things, while the Republic may have legalized abortion since 2018, in the North, it's still very much an issue for contention. And that debate, which is really live and political, is sort of happening under the shadow of COVID and is really not getting the attention that it should get. And there's undoubtedly women experiencing crisis pregnancies who would have normally resolved this through travel, cannot do so at the moment. But there are other things as a historian that kind of would give me pause for thought, and those are the rhetoric and the way in which the debate about certain things are being framed. One little vignette I might give is the way in which nurses, and particularly female healthcare workers, have been presented in the public eye. And one little anecdote comes from the UK, which is where they went out every week to clap for the NHS staff. And in much of that rhetoric, it was actually female nurses that were really kind of fronted as angels and heroes. And at one point, one member of the political establishment in Britain referred to possibly giving nurses a medal, to which one female nurse said, don't bother with a medal, just give us proper terms and conditions and pay. So I thought it was very interesting that very old 19th century rhetoric about nurses as angels and heroes was sort of being counteracted by another narrative, which was actually all we ask for are equal working conditions and respect. So as in all moments, I suppose, I have little doubt that we're living through a historical transformative moment. The question is what we will make of it. And I think one of the interesting things to discuss in this seminar might be the ways in which we could actually use the opportunity to maybe transform things in a positive way. So the fact that we've had a focus on things like domestic violence, or the fact that we focused on the fact that lesser paid jobs or temporary jobs or more vulnerable jobs are actually those that lead people, in the case of a pandemic, to be really exposed in terms of safety and their lives, might actually lead us to examine what jobs do we value and how do we express that value. And likewise, in relation to reproductive rights and bodily autonomy, I think it's an opportunity to decide to have a more broad discussion about that. This shouldn't be contingent on people's ability to travel and to move. It should be a human right that isn't up for grabs, even in the context of a pandemic. And there have been reports throughout Europe of women being denied birth partners, being coerced into undergoing medical or intrusive procedures in the birthing environment, and other stories of women being actually abandoned entirely to the birthing process themselves because of a priority in the literal space for putative COVID patients, which sometimes don't materialize. So for me, I think it's interesting to think about the continuities, the historical continuities, about the sort of work we value and the sort of emphasis we place on the domestic arena and caring, and the wider notion of gender violence and autonomy and access to space and to the public debate. So I think those are the things that might be interesting to throw open for a broader discussion during the seminar.
Thank you very much. I mean, that was a bunch of fantastic observations and analytical approaches there. Very difficult for me to try to transform that into something that opens a conversation now. But when I think of so the short history of webinars we've done so far, one thing that came back time and again was this idea of these COVID-19 pandemic being almost like an X-ray to our societies, looking at what the pandemic has revealed are the weaknesses in each and every of our societies. And what you've just sort of outlined confirms that pretty much. And Anuj just said, COVID has not introduced anything new. It has sort of exacerbated and accentuated inequalities and injustices that have been there before. Have these injustices, I mean, we looked at it globally and kind of regionally, but have they impacted on individual societies in a different way? Or can we sort of look at this sort of in a global way, saying, this is the effect of the pandemic, and it has in general and all over the world disenfranchised women, affected women in particularly negatively, and men, those ones who survive, come out the better for it. Not an open enough question, I presume. And the idea basically trying to bring this idea of the X-ray that COVID-19 might be into our realm. Is it an X-ray to our societies?
So maybe I will try to join in. I'm not sure I got your question properly. I was thinking more that you are more asking us about the new opportunities and this transform. Well, you had several questions in one, I guess, because you were asking us about the variations. And so if we can talk about one big trend and one sort of transformation as a consequence of the pandemic. And I think several of us have made some comments trying to make it clear that most likely we cannot do that. And it is exactly what we need, better understanding, well, whether you call it heterogeneous effect or you call it intersectionality, it's all kind of drawing attention to the need to look at little details and observe the different parts of the societies more closely. Just coming back to the issue of how you divide the domestic work at home these days, we are talking about big tendencies, but if you just start thinking about the families next to you, you will easily find out that in some of them, both parents are working at home teleworking and are in the position, in principle, to distribute the additional care work evenly, where in other families, one is working and the other is not. Probably on the most interesting side are those where it's the mother who is away for work during the day and the father either lost the job or teleworking from home. Well, it can happen, and some of the data is already suggesting this, that in some cases that they reverse the traditional gender roles. So even if just in a small segment of the society, even if just for a small amount of time, we can see major shifts from what we were used to. How much it will last, how long it will last, how widespread influence it will have beyond those few families. These are major questions and we don't have the answer yet. We know that it will not be the same depending on the country. I also suspect that, that with some well-targeted policy measures, we can promote these positive tendencies. We can somehow help them to survive beyond the pandemic, but still don't know yet what will happen on this field. But maybe I stop here and then others can pick up on different points of what you said.
So I'll probably just add to that. I mean, going back to the point that you're making, Georg, I do feel that it has affected different societies differently. And I think that's where the challenge lies. I've written about this, part of this Migration Health South Asia collective that I lead, that what COVID has also shown light on is the failure of global solutions and global policy and messaging to reach out to most vulnerable in different societies. And while I mean, I'm going to give an example of South Asia here. I mean, South Asia, most countries announced lockdown very early on, and in some contexts, even without enough preparation and notice. Within 4 hours of, within 4 hours, they announced lockdown. And I mean, the South Asia has a very unique context. I mean, 80% of the total employment in South Asia is in the informal economy. So with the idea of social distancing, the idea of isolation and quarantining is needs to be visualized differently in contexts such as the resettlement areas, the largest slum areas are in Asia. And what we found was, as a result of those lockdowns that were imposed, we suddenly completely invisibilized the contextual realities of those migrant laborers, for example, who were then stranded in cities, evacuated from their residences, but unable to reach their villages or other countries where and they were found traveling on foot for hundreds of kilometers to get to the villages, but only to be beaten up when reaching there because they were seen as carriers. So it is important to then think about how these public health messaging, how global messaging around the solutions of pandemic needs to be very contextualized to those inequalities and how those inequalities are structured in different societies. And it will inevitably have winners and losers, as you were suggesting. I mean, there would be certain opportunities there are. I mean, I think Lindsey was also referring to those in revisiting the sort of power relations within households or in particular economies, ensuring that moving from here on, we do install those kind of social protection mechanisms that most people in informal economy are denied of. And I think there are those opportunities, but then it is also important that that kind of advocacy efforts accompany the research and evidence generation that we are trying to contribute towards, to demand those rights, to demand those entitlements moving on from here.
Mm-hmm. 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 Yeah.
Yeah, if I could just come in and say that, yeah, no, the really big challenge will be that the challenges are so specific in certain locations. Even within countries, you will have certain groups of populations much more greatly or much more adversely affected. You can even look in a lot of populations in terms of age as well, those who were in nursing home environments, receiving less protection than other environments, or indeed in Ireland, people in direct provision, which is the provision for refugees, in which they were closely cohabitating and didn't have the space. And so even that kind of the notion of the politics of space is radically different on socioeconomic grounds, racial grounds, geographical grounds. And as somebody who lives in the EU, I think one of the most confronting things was how quickly the notion of the EU collapsed for people at a kind of grassroots level, where countries really reverted to the national borders, and there was very much a sense that you were thrown back on your own government, and your rights, or things that you took for granted in terms of the ability to move and control your space, were really subject to removal at a moment's notice. And I think that's going to leave a very lasting effect on people, and their kind of confidence in the institutions, either of their own state or in the case of the EU.
Mm-hmm. I think that does, going back to the national level, and that renationalization of politics, policies and reactions was probably one of the most frightening things, particularly for us here in Europe, I have to say, who got used to open borders and sort of a supranational structure that seemed to have overcome nations. There's one question that fits in quite well with this current discussion, and that is the fate of the NGOs, for example. How do the NGOs fare in this particular situation? Non-governmental organizations who are being threatened at the moment. This one person who asked a question here talks about Turkish NGOs who can't help, who are not allowed to step in when it comes to the Syrian refugees and so on. They seem to be in a complete limbo because they're not national and not supported by any nation. So that's a completely different side of the discussion that we are having today as well.
Maybe I can say a few words on this. As you said, yes, like we observe a kind of tendency towards isolationist and nationalist government policies these days. But these days, actually, we need more transnational solidarity and cooperation. And we need to rethink and explore new mechanisms, new structures to build a kind of transnational solidarity, cooperation, what type of new institutions we need to build, what are the new principles, values that we need. I think these are the questions that the global community should continue discussing more. But I agree with all other comments that despite the deepening effect of the COVID on existing gender inequalities or social inequalities in general, it also provides a kind of opportunity to rethink, reshape the structures, norms, assumptions that our current societies are built on. We can find ways to turn this crisis into an opportunity to drive a transformative change for more equal, inclusive, sustainable societies, resilient societies. And this also includes national borders. Like we can also rethink about the national borders and our current nation state centric system regime. I think for the next steps for building such a society, it is important that we need to put women and other discriminated people. This includes refugees, LGBTI refugees, Black individuals, and all the intersecting, all people living in a kind of situation, experiencing all these intersecting dynamics. We need to put these groups at the center of our new way of imagining a new world, while designing and implementing the response and recovery efforts. All the mechanisms should ensure effective and active participation of these groups. Multiple intersecting forms of discrimination should be addressed, and we should prioritize improving public health for all. We should prioritize caring and social security systems, like improving our caring and social security systems. We should prioritize eradicating poverty for all. this is going to be a challenge, but we need to find ways for transnational cooperation and solidarity.
I think you're 100% right, and I hope that this is going to be I think one glimmer of hope I would have is that the pandemic has shown opportunities that prior to the pandemic nobody thought were possible. Suddenly things are possible when it comes to traffic, to pay, to all sorts of areas that prior to the pandemic seemed to be sort of not possible at all. Therefore, I think we might sort of start thinking in different realms of more holistic societies and try to implement these aspects that you just mentioned, because they make much more equal societies.
Yeah, I mean, if I could come in that, I mean, in some senses, the things that were negative and highlighted as negative are the flip side of that are positives. And by that, I mean, we had a lot of attention placed on workers that were at the coalface and that we called, what were they, frontline workers. And at the first reference, people were talking about medical personnel, but actually as the conversation deepened over the pandemic, people were talking about bus drivers, they were talking about cleaners, they were talking about, so the kind of the idea of a frontline worker and the status that gets actually broadened as the pandemic went out. And one possibility from that, from the appreciation of the roles that those kind of people play in societies, could be some more leverage in a post-pandemic world for those jobs to be valued at a greater way. The other sense too is this, for me anyways, the sense that we have to have structures that withstand this sort of stress and crisis, where you had a feeling that people weren't the things that felt solid actually sort of melted away very quickly, and people were unaware of what their rights were. And indeed, you got a sense that states themselves were not fully clear about what the rights were and the relationships to other states were. So there is a sense that you need a broader and a clearer messaging around what people's states and rights are in relation to public health access, relation to movement and travel, but also basically, quite literally, your bodily integrity, whether you know what your rights are if you are confined to your home, and what does that home mean. There's also been a much greater focus on this idea of what domestic space is. So for some people, it's a fairly luxurious home. For others, it doesn't exist at all. And one of the things that you saw in Ireland was we have a very big homeless problem. And that was something that was sort of able to temporarily be, dealt with when there was a pandemic, when in a really visceral way, everybody's welfare depended on everybody having a home. And if that's a lesson that you can carry into making the access to a home a right, because actually that's something that benefits all society, then that's a pretty good lesson to come out of it. The question is, how do we keep that pressure up, and how do we translate that into long-term reform, I think.
Yeah, the question to me would be, or the danger would be that we're all longing for normality, a pre-COVID normality. Going back to that pre-COVID normality, we're going to cement the inequalities that were there. What can be done to fight that? Would you have any ideas? Sorry.
No, I think excellent point, Georg. I do see COVID as offering us opportunities, but I'm not as optimistic about those opportunities, because I think the structures of oppression continue, even though we are realizing the people who are oppressed are the ones who are at the front line and risking their lives, right? And I'm going to give you a few examples. I mean, one in the UK, I mean, interestingly, the whole ethnicity debate and the public health review of the ethnicity question, omission of the structural inequalities and racism that they face in the UK, came alongside the George Floyd debate. And what sparked was even more racism. There is solidarity. There are a lot of people marching together on this issue, but there is a complacency about interrogating our own sort of privileges and the oppressions that we are complicit in. The same thing we note in the issue of the migrants in large parts of the country. I mean, there are some relaxations in policies for asylum seekers and refugees, but they're continuing to be deaths reported across border. There is still no commitment to open borders for those who are in these extremely vulnerable situations. And I think we risk that we continue the status quo, and that what we're talking about as the new normality may be only a new norm for some. We don't want to go back to the norm that existed for a large section of the society, which continued to be oppressed because of these the kind of structural inequalities and institutions that are in place. So I think what we also need, and I'm going to go back to the point about the question about organizations. It is not COVID that is particularly disenfranchising these organizations. These organizations were acting in extremely repressive environments, and we know the civil society space was shrinking even before the pandemic arose. And it will continue to. We continue to see a very anti-immigrant narrative. We continue to see a highly transphobic and homophobic narrative in states today. So that really hasn't changed. What I do believe is there is a very important role to be played by social movements. And not only by social movements, I think we need to talk beyond epistemic communities. I think as academics, we need to engage with these social movements, with these advocacy initiatives, and vice versa. I think we need like stronger synergies built across these epistemic communities. We can no longer continue to work in isolation and picking and choosing issues that we work on without a very clear human rights, equity, and social justice perspective. I'll just stop there.
I think that's a very, very good point. Yeah, and I just try to be optimistic because I totally share your views, and because everybody's longing to go back to what they had, and there seems to be very little appetite left to make fundamental changes, especially because these fundamental changes would be rather vast and would really, really change our societies, would change the gender roles in our societies, definitely. And from my perspective as a male human being, I'm not sure how big the appetite is sort of among the male population sort of to do just that, you know, and to change in a consistent way these societies. But can anybody come up with any kind of glimmer of hope sort of where we might see positive changes in the future? Are there recommendations? Are there are there any small candles at the end of the tunnels that would sort of lead us to believe that things might be better post-pandemic than they were before pandemic in our societies?
So I do believe the positive change has been a greater focus on inequalities and injustices. And even researchers for who inequities was not an area of researchers, of research, or aspects of, you know, different aspects of social identity and social location was not as direct a focus as they've started looking at those. And I do feel that that's clearly a positive response. And we're seeing phenomenal initiatives on the ground. I mean, there are, despite the very constricted space, there are very encouraging documentation, local initiatives that are reaching out to tackle these problems. I think that's what we need to make mainstream. And I think that's where I see as an opportunity.
Yeah, and I would agree with that. And I also think this kind of the lie of we're all in this together and the repeating of that phrase all the time has actually made lots of people think about the ways in which they're doing okay and others aren't doing so well. So this notion of complicity is something that I think people are, a broader sector of people are really thinking more deeply about that, partially because there's actually been, for some anyway, the space to think, but also with things like the protests that are going on and the worldwide element of that has really made people think about, well, for as a white woman, what was my role in racial discrimination? How have I benefited from a system that has benefited white people, and so on? And I think as well, this notion of the broadening idea of human rights and the relevance of human rights for all disciplines, and we have increasingly put a gender check in our work. So particularly those of us who are working in academia will routinely filter what we think and do through notions of gender, and the way in which even the idea of gender and the body are diversifying and becoming more complex. But I think we're less likely to do that in terms of human rights in a broader sense. And I do think that that's something I've heard repeatedly in seminars like this over the last few weeks, where people are really thinking at a more grassroots level of human rights and what it means in a day-to-day, in your day-to-day life, than at that kind of upper level. So that would give me hope. And also the younger generation, those in their 20s, who are really, really impacted by this, and at this really important moment in their own development, the kind of microscope has been placed on all sorts of things like a right to a job and a right to a home, a right to movement, a right to travel, and they have access to social media, which still terrifies most people in my generation, and they're using it. Yes, of course, there's lots of terrible stuff that's happening on social media, but there's also a pretty wonderful conversation happening, and it's really very dynamic and changing day to day. So I think that's somebody working in a university sector and seeing those young people, that fills me with a lot of hope as well. But I am also terrified as a historian too, because I do know the tenacity of prejudice and the degree to which it raises its head wherever you give it space. And it's kind of depressing to see the extent of tropes and images that just keep getting trotted out, and the degree to which certainly at an upper political level, the powers that be are sort of talking across some of these lessons. The classic example would be the one that you gave in there in relation to the impact of COVID on particular racial groups in Britain, for example, and the way in which the British government has dealt with that alongside the Windrush and other issues, and the sort of the insistence that these are parallel rather than intersecting conversations. Mm-hmm. That's a bit depressing.
Mm-hmm. Yeah, I mean, you probably can pin a lot of hope on the young generation. I mean, they exercise through Fridays for Future, and they know how to mobilize, but they also impact on an individual level. I mean, one question came in: what's the future of au pairism in across Europe? What's the future of Erasmus exchanges and all that? So that is sort of a very individual level where young people are affected. They cannot sort of take the rights that previous generations had, because they're simply not allowed to travel in the same way as sort of their peers were. So there's a lot of dynamic there, and we know that young people always want to change the world, and here is an opportunity basically. So let's hope they take it and show us old folks what can be changed. Are there any other observations that you'd like to share with us?
May I was thinking about your previous question about the optimism and like potential. I mean, the hope, if there's any hope. There are actually some good practices, or let me say innovative practices that can be inspiring for policymakers, decision makers around the world. For example, some countries, some governments actually introduce parental leave measures, childcare vouchers provided to both parents regardless of gender as part of their COVID response packages. Like in Austria, Italy, France, they took COVID as a kind of opportunity to reduce and redistribute women's care work, and I mean such parental leave measures or newly introduced measures can actually contribute to redistributing caring work, and it can contribute to increasing men's participation to unpaid care and domestic work. And while there are also like innovative practices when it comes to domestic violence prevention. Like there are some governments, I think that was in Italy again, like instead of, for example, survivor having to leave the house of abuser, prosecutors have ruled that in situations of domestic violence, the perpetrator must leave the family home. And since during this COVID process, it was really hard for women to reach help and justice. Like there were some innovative practices, I think that was in UK, like delivery drivers and postal workers are being urged to flag signs of domestic abuse and report any concerns to I mean, these are all small examples, but still these are innovative ways and new ways to think about for future. And I think for designing the new response and recovery efforts, it's going to be really important for the governments to follow the principle of substantive equality against a formal approach to equality. And the governments have a kind of duty to take positive redistributive measures in favor of historically disadvantaged and marginalized groups. And then maybe we can achieve a kind of rapid recovery from this crisis, and we can also increase our resilience. Thank you.
Mm-hmm. Thank you.
You know, can I just add very quickly? I mean,
go on.
Because we're talking about the path to recovery and relationships and the new. I think what is also quite critical is that this. Can you hear me?
Yeah, you're frozen, kind of frozen.
Hello?
At the moment. Yeah. Can you hear us?
Can you hear me now?
Yes. Yeah. Okay. You seem to be okay.
Yes.
Yeah.
Okay. Okay. Right. So I think in this process of reimagining a new world and thinking about a more egalitarian world, I think an aspect that we've not really looked at is also reimagining the relationships across nations and the divide and overcoming the divide between that global north and global south. And I think this pandemic is one that has taught us to learn from different countries about the successes and the failures. And it really shakes that whole divide between the North producing the right kind of knowledge and modeling, significant policy failures in the North. And we are low middle income countries the time to, and I'm going to use this term to actually come out of our arrogance around where we ought to turn to understand how we can do better. Sure. And I mean, I'm giving some examples around what Kerala state has done in terms of its fantastic contact tracing and testing models, the community care models that it had in place. But there is, I feel, still a resistance to learn from these the cases in the global south. And I think in the reimagination, we really need to look at those post-colonial contexts and to see where knowledge resides and how that gets disseminated.
Yeah, very, very good point. Can I pass on to Zsuzsa Blasko? You were going to make a point a second ago.
Yes, I was just about to suggest that maybe for a second we should also reflect upon the fact that I think all of us are now working from home, which is definitely a major change the virus has brought by. So around 40% of the workforce in Europe is now working from teleworking. And teleworking has always been considered as a great and major way to sort the big issue of work-life balance and achieving better balance of between men and women in sharing workload. So now we have this as a reality. This is an opportunity and definitely something that might be an element of our future if we take the opportunity and if it gets promoted somehow and reflected upon after the pandemic. So you asked for good, for positive signs, and I'm sure that this is one of the biggest ones, at least in Europe, at the European level, the one that is affecting a big part of the population.
Yeah, I think it's definitely a major step forward, but we need to consider that home office is more than a laptop on the kitchen table. I think it requires needs a bit of an infrastructure as well, because for obvious reasons, I think. But yes, that is definitely a positive sign. Any other? I'm looking at the questions. The questions have kind of dried up at this stage. Are there any other final points that you'd like to make on this issue? Which I have to say, from my point of view, following the webinars that we have done so far, is probably the biggest issue we've tackled so far, because it involves all of humanity, male and female. We've looked at minorities, we've looked at various other pieces, but here we are at the core of society, at the relationship between men and women, and the increase of inequalities between male and female, but also between rich and poor, and between educated and non-educated. Therefore, this has been a vast topic today, much bigger than the 1 hour could possibly sort of deal with that we've had to date. Can I, at this stage, sort of thank the 4 of you for joining our webinar. Lindsey Earner-Byrne, Associate Professor from University College Dublin, School of History. Anuj Kapilashrami, apologies for that, Senior Lecturer in Gender and Global Health Policy, and soon in Professor of Global Health Policy and Equity in the School of Health and Science in the University of Essex. And Zsuzsa, Blasko Research Fellow at the European Commission, and Sebnem, Senior Policy Advisor at the Raoul Wallenberg Institute of Human Rights and Humanitarian Law. Thanks also to Johanna Mittahu, who has organized today's webinar, and for Kerstin, who took the questions. Thank you all very much for a very engaged and very interesting discussion that, as I said before, should probably last well into the night to sort of look at all these aspects properly. But thank you very much for making the effort and to sort of bring it to us in a nutshell. Thank you very much, and talk to you soon. All the best.
Thank you.
Thank you.
Thank you.